That research about fat shaming at the doctor's office revealing that the way physicians address overweight patients may be doing more harm than good. And our senior medical contributor, Dr. Jen Ashton, just walked onto the set to join us. So good morning, and tell us what the headline is here.
So this was a study done at University of Connecticut Department of Psychology, and they were looking at this issue called sizeism, which is the practice of thinking that you can assess someone's health purely by their body size, whether they're too thin appearing or too overweight. And what they found, unfortunately, is that many, not all, thankfully, doctors actually echoed a lot of the same beliefs that we hold in Western society. And I'm going to quote from the study now. They found that a lot of these doctors considered people who are overweight or obese to be bad, lazy, stupid, worthless. These are obviously incredibly hurtful, very hard to hear, and they're medically very wrong.
Yeah, we actually have some tweets. Some of our viewers tweeted some experiences on this topic. Claudia said, I weighed 160 pounds and I'm 5'8", and the doctor wrote in my chart that I was an obese native female. That was 10 years ago, and I have never forgotten. And then someone else tweeted that their doctor told them they could, quote, stand to lose a little more weight. They say they left and took the walk of shame. The importance of the patient-doctor relationship and how it impacts people emotionally can affect them physically.
And I think the bottom line here is that not all healthcare providers are good communicators. They're not all considerate. They're not all sensitive. And yeah, you run the risk of obscuring any positive clinical or medical or therapeutic interaction there by the negative. That's all someone's going to hear. And then they might not come back for screening tests. They might not come back for follow-up. But I think it's also important to realize that ideally this should be a two-way street. So doctors need to be better communicators in every way, but patients also need to try to be receptive. And when someone says, especially a healthcare provider, I'm concerned about your weight, hopefully they hear that as a medical observation, not a social judgment.
Right.
So we need to do a lot of work
and
on this.
certainly there's a way to say the same thing, to have the message, but to have it be heard
constructively or in a kind way.
Exactly.
Right.
What's your advice to doctors on that?
Well, look, when I got board certified in obesity medicine, we learned the facts that we don't understand completely what causes obesity, but we know what doesn't cause it. It's not caused by laziness. It's not caused by a lack of commitment. So I think the tips here for doctors, you should ask the patient permission to discuss their weight. Ask them first. You should explain the health concerns that exist that we know from medical data and literature. You should set realistic goals, not I'd like you to lose 100 pounds because I'm just pulling that number out, but this is what we need to get you to be healthier. And then you should help that patient make a plan.
Right.
It's not just about stating I want you to change and then leaving them to, you know, flap in the breeze. You need to actually make constructive plans.
Yeah, and we've reported people are healthy at all different shapes and sizes.
Yep.
A lot healthier than you'd think.
And by the way, you can be quite unhealthy, very underweight also.
Yeah.
So it goes both ways.
Thank you so much, Dr. Jen.